Prynawn da, good afternoon everybody. I'm Dr. Frank Atherton, I'm the Chief Medical Officer for Wales. And what I wanted to do today was to give you, as I have in previous times, an overview of the current situation and the developing situation around coronavirus here in Wales, particularly focusing on those areas where we have local restrictions in place. And as we start to plan, continue to plan for what may well be quite a difficult winter, I also want to go back over what we're asking people to do, the simple steps that will help to keep us all safe and healthy through the winter. And finally, I'm going to just talk very briefly about the prospects for vaccination, which of course we all need to keep in mind. So, in the space of the last few weeks, last 4 or 5 weeks, we've really moved very significantly in Wales from a position where we had very low levels of coronavirus to a resurgence of viral transmission. If we think back to July, August, we were seeing in the range of 20, 30 cases, new cases of coronavirus every day. Well, yesterday we saw 752. So there's been a step change. Of course, we're doing more testing, but there is certainly more viral transmission going on. That matters. It matters because, as we know, if the virus affects older people, they can run into problems with their health. They may well need hospitalisation and they may well need extra support through intensive care. And we are starting to see small increases in all of those things, in people being admitted to hospital, in people being admitted to intensive care unit, and that's something that we've wanted to avoid here in Wales. And that's really why, over the last few weeks, we've been introducing local restrictions or local health protection areas in areas of Wales where we see viral transmission particularly increasing. That's happened in 15 local authority areas and in Llanelli. And those restrictions are in place really for two reasons. One is obviously to protect people's health, as I've just described, but also to stop the virus from spreading, either spreading within those communities or spreading from areas of higher transmission, higher viral load to areas where the virus is less active. And we want to prevent that if we can. Well, those restrictions have been in place for about 4 weeks now. And there is some evidence to show that they're working. And what I'd like to do is just to show briefly a slide which shows some of this effect. And if we look at this, this shows the local authority areas that have been in local lockdown arrangements. If we look at Caerphilly, for example, that's the grey slide. That was the first area to go into a local health protection area arrangement on September the 8th. And you can see how after the arrangements were put in place, some of these areas have started to see an improvement in the number, a reduction in the number of new cases. And that's a good thing to see. The top line, Blaenau Gwent, is the blue line, and that showed the steepest and the highest rising cases, as did Merthyr Tydfil, that's the dark green line. And in both those areas now we're starting to see some improvements. We're still high rates of viral transmission and high rates of new cases, but some improvement, which is a good thing. Even in Rhondda Cynon Taf, the red line, we're seeing some improvements, although of course we've had issues there with an outbreak of coronavirus at the Royal Glamorgan Hospital, which is still being managed and being brought under control. Just to say a word about Newport, which is the orange line there. We have seen a decline in Newport, but that's been slowed because we know there's been an increase in cases in Newport related to house parties. So those are the sorts of things which can delay the improvement in the patterns that we're seeing. So the good news, I suppose, is that we do have some evidence that the local restrictions, the local health protection areas, are having some benefit and that they're starting to improve the picture. And as the First Minister said just last Friday, we're working on how we can now remove those areas, remove the restrictions in those areas so that people can pick up their lives as usual. And we do have it's not a hard and fast metric, but we normally look at the number of cases per 100,000 population. And when that comes below 50, we start to think about whether we can release some of those measures. What we don't want to do, of course, is to simply relax the measures in an area and then have to, maybe a week or 2 weeks afterwards, to put those back. It may be that we do see a rolling programme of putting restrictions in place and removing them. We don't want to do that, but that may be something that we have to think about as we go through the autumn and the winter. So although all of us would like to see the back of coronavirus, it's going to be with us for some time, and we're going to have to learn to live with it to some degree. So having a flexible policy which helps us to move in and out of restrictions is probably going to be quite important. The situation is still very fluid in Wales, as it is across the UK and the rest of Europe and the world, in fact. And we can't rule out further restrictions, but at the moment we're looking to the local health protection area arrangements to try to guide us through the current situation. I know that people don't want to hear that further restrictions might be necessary, but especially as we've been through a very difficult time, we got into summer and things were improving in the summer with very low levels of transmission. It's not what people want to hear, but I think we need to prepare ourselves for quite a difficult winter, because it's really while we wait for and hope for a vaccine to become available that we have to really look after ourselves and keep viral transmission low. And every time I speak, of course, I remind people that there are some very simple ways that we can do that, and I'm sure everybody knows those. We need to maintain social distancing. That's the most important thing. Maintaining respiratory hygiene, regularly washing our hands, using face coverings when we're not able to socially distance properly in indoor spaces, working from home wherever we can, thinking, all of us, about who and where we meet with people. Outdoors is safer than indoors, and smaller numbers is safer than larger numbers. And the final thing, of course, is that anybody who develops symptoms of coronavirus, be it a cough, a fever, or loss of sense of smell or taste, needs to both get a test very quickly and to self-isolate while they wait for the results of that test. If we're all diligent about these measures, I believe that we can improve our chances of removing those lockdown arrangements, those local lockdown arrangements, those restrictions, and buying ourselves some headroom so that we can get through the winter. I did say I would very briefly talk about vaccination. Of course, these measures are important while we expect and hope that a vaccine will be coming. There's a significant number of candidate vaccines available, and there's a lot of work going on both at UK level in terms of forward procurement of potential vaccines, and also in terms of planning through all of our local health boards about how we would deliver a vaccine programme. There are a number of promising candidates, and we hope that in the early part of next year we may well start to see vaccinations becoming available. It certainly won't be available for everybody immediately, and so we will need to have some prioritisation to think about how we protect the most vulnerable, how we protect our health and care system. So we're undertaking a lot of planning through the health boards at the moment to think about how we might deliver that programme. So thank you. I'll pause there, and I will be happy to take some questions. I'm sure there will be some. So I think Adrian Masters from ITV is first on the list. Adrian.
Thank you, Dr. Atherton. Can I ask you to say a little bit more about the different age groups? Are there signs that the virus is moving from younger people into the older population? If so, how will that affect your decision on restrictions? Will it lead to more nationwide measures or perhaps more targeted measures?
Yeah, I mean, what we saw with the resurgence of the virus is it was largely in younger populations than we saw back in March, April. So it was the 15 to 24 and into the 30-year-olds. But we are seeing some movement into older groups. So to give one example, Adrian, in Cardiff, in the first week of August, about 11% of the positive cases were among the over 60s, whereas in the first week of September, the last week of September, that was about 16%. So it is moving into the older population, and of course that worries us, because we know that with age comes increased risk of serious illness and the need for hospitalisation and intensive care. And of course the mortality rate goes up. So we do worry about that, and we watch that very carefully, Adrian. Yeah.
Thank you. And on restrictions, whether they're nationwide restrictions or other, will there be what some people are calling a half-term circuit break in Wales with extra restrictions? If so, what sort of restrictions are you considering? Would it be closing pubs and restaurants earlier or altogether?
Yeah. As I said, we're not ruling out the need for further restrictions. At the moment, we're not planning on those arrangements, but we're keeping that under very close review. Our hope at the moment is that our local health protection arrangements, those local restrictions, will continue to lead to an improving situation. But certainly we don't rule that out, and it may be that we need to think about further restrictions, but there's no plans for that at the moment, Adrian. Thank you. And we've got Catherine Half-Jones from BBC Wales.
Good afternoon, Dr. Atherton. You've spoken of possible rolling local lockdowns over the autumn and winter, but there are calls from opposition parties for more targeted hyper-local lockdowns. There's currently one in place in Llanelli. Does a hyper-local approach work? And if so, why aren't we seeing more of them?
Yeah, well, our arrangements in Wales currently are that we work very much with the local authorities. And whenever we see an increase in the number of cases, an incident management team is formed. That works across all partners, including the local authorities, and they then provide updates to Welsh Government and requests for any additional support. So that's the mechanism we have in place. We don't rule out more local arrangements, but the local authority feels like the right democratic boundary to use for decision making and for making decisions. At the moment, Llanelli is the only place where we've got a non-local authority place, but we certainly don't rule that out in future. The issue in Llanelli was that it was very much contained within the town itself, as opposed to having broader community transmission. So we have to take the circumstances of transmission, not just the numbers, but actually the detailed information that we get from people on the ground into decision making as to what the right area should be.
Thank you. And the most recent TAC report published yesterday warns that unless the R rate is brought back down below 1, it is possible that infection incidence and hospital admissions may exceed scenario planning levels. What does exceeding scenario planning levels mean? Does it mean running out of hospital beds, running out of PPE? Can you elaborate on that, please?
Well, the R number we think is around 1.4 at the moment. So that just means that the virus is still in growth, and that does mean that we can expect to see more cases. We can expect to see an increased number of hospital admissions. The scenarios, we have a number of scenarios that have been developed to really just to guide the planning. It's not a prediction in any sense, but it gives us a feeling for the number of hospital admissions which are likely. And so what the TAC report is saying is that with things as they currently stand, there's a possibility that we might go beyond those figures. It doesn't mean that the NHS will run out of capacity or PPE or anything. It just means that we need to change some of the planning assumptions, and health boards need to take account of that, really. But I have to stress that all of those reasonable worst case scenarios, as they're described, are subject to a lot of variation. So any changes can lead to kind of quite big swings in what the model shows. It's a helpful tool for planning, but it's only that, really. Thank you. And we have Andrew Forgrave from the Daily Post.
Good afternoon, Dr. Atherton. Just picking up the point you made about local, hyper-local lockdowns. There's been a lot of speculation that Bangor is set to go into lockdown. Is that the case, or will a rise in cases in the city lead to a county-wide lockdown?
Yeah, and Bangor is under active watch at the moment. Gwynedd, generally, as the local authority area, is being considered, and there's an incident management team that's been meeting on a daily basis up there, and they're providing reports and suggestions into Welsh Government. So we're looking at that quite carefully. In Bangor itself, much of the increased number of cases in Bangor has related specifically to the student population, where we have an increase in number of cases which are related to specific outbreaks. It's kind of easier to manage that because we have outbreak control teams that can go in and work with the communities affected and can help to bring that under control. It's where we have broader community transmission that the local lockdown arrangements are more effective and more likely to be put in place. So we work with the local authorities and we wait to see what their request for support from Welsh Government might be, whether that would be on a Bangor basis or on a broader local authority basis.
Thank you very much. You may be aware that the leader of Conway Council yesterday called for a local lockdown in the county to be lifted, and he said it wasn't based on evidence and seems completely disproportionate to the reality of the situation there. He claims that local tourism is being destroyed and people's well-being is suffering. Is the Conway lockdown an overreaction?
Well, I think in all of the areas where local restrictions have been put in place, there's been discussion with the local authorities. What we don't do in Wales is just to impose from Welsh Government restrictions on local authority areas. I don't think that the request was to completely do away with all restrictions. I think it was specifically around the travel out of the local authority area. We don't have a position where every local lockdown area, every local restriction area needs to be identical, and so that is a discussion that Welsh Government will have with the local authority about whether that is the most appropriate thing to have in place. But it brings, to stark relief the fact that we are dealing with difficult decisions and difficult trade-offs here, and those restrictions, of course, are in place to protect public health. We recognise absolutely that there are economic and social consequences for all of those decisions, and it's really for the system that we've created with the incident management teams, the partners coming together to try to weigh up those different factors and come to the best decision in the interest of the people of those communities. So we'll continue to work with Conway and other local authorities on those areas. Dan Bevan from LBC.
Good afternoon, Dr. Atherton, and thank you. Ahead of World Mental Health Day this Saturday, do you feel enough is being done to help the mental health and well-being of young people and children throughout this crisis? And what can the Welsh Government do going forward as we're being told we need to live with this virus?
Yeah, one of the really important consequences of the lockdown and then the stresses we've been through and the issue around examinations for children and university entrance, all of this we absolutely acknowledge has led to increased mental health stress for the population in general, for older people in the shielding group, but also you're right to say, Dan, for younger people as well. And so, we have, the government has invested additional resources in terms of providing support into those areas. We have to work with the sectors that support children and young people. Safeguarding has been a very important issue that has needed additional attention through the lockdown. So, there has been quite a significant recognition of the problem, significant working with the various sectors to try to address it. But I'm sure what's behind your question is right, that there's more we need to do to think about that. So thanks for that, Dan.
Thank you. And with regards to what the First Minister mentioned about the potential vaccine not being treated as a silver bullet, from your perspective, what do you think about the optimism that's around a vaccine? And how realistic do we need to be with regards to timeframes and the effectiveness of a vaccine once one is available?
Well, there's trials going on around the world, of course, on coronavirus vaccines, and in Wales we are participating in those trials as well. So I am more optimistic, I would say, about the prospect of effective vaccines becoming available than I probably was 6 months ago. The time frame is really difficult to judge with these. We've seen with the Oxford trial being paused and then restarted that it's not a smooth journey by any means. There are different vaccines in development which will have different methods of delivery, different timings, so it's going to be very complex to deliver a vaccination program against coronavirus. When the vaccines do become available, although the UK has made some advanced purchase arrangements with a number of potential suppliers, the demand, of course, globally is going to be enormous, and so getting adequate stocks to deliver it will be very challenging. And of course, the delivery mechanism, through existing health services and through other routes, will need to be very carefully thought about. That's what health boards are currently planning for. So I am optimistic, Dan, that vaccines will become available. I think that's one of the ways out of the conundrum we find ourselves in around coronavirus, and we need to continue to follow up, keep a very close watch on that, and get ready to use to use the vaccines when they do become available. Thanks, Dan. Mark Smith from Wales Online.
Thank you very much indeed, Dr. Atherton. Academics from universities across the UK have signed a declaration which calls for a herd immunity approach to tackling the pandemic while protecting the most vulnerable in society. They claim this approach will allow people who are less vulnerable to the effects of the virus to return to normal life. What's your response to this approach?
Well, we keep all suggestions under consideration, and we do need to continually think about our approach. At the moment, we have an approach of trying to keep the viral transmission as low as possible while we wait the vaccine I was just talking about. The idea of allowing the virus to transmit through the population is a difficult one because it would inevitably lead to more hospital admissions, ITU admissions, and ultimately to deaths. So it would come at a very significant cost. And the other difficulty with that, I don't rule it out, but the other difficulty with that is, of course, that we just don't know enough yet about the immunity which follows on from somebody having had a case of coronavirus. So we do know that there are cases around the world where people have been infected more than once. Those small numbers, but we just don't know how long immunity will last, whether it will last for a short time or a long time. So it's something that we need to keep under review, but at the moment that's not the strategy here in Wales.
Thank you very much indeed for that response. And secondly, do you think that US President Donald Trump's recent comments on his experience of coronavirus and telling people not to be afraid is giving people in Wales the right message? And do you believe it will make it harder to get across the important guidance about social distancing, wearing masks and following the rules?
Well, I would hope that most people in Wales don't take President Trump as their guide to how to deal with coronavirus. I think people are perhaps a little more thoughtful than that. And I would certainly hope that most of us now in Wales, have lived through this for the last 9 months, have seen friends and family who've run into quite serious problems with coronavirus, and many people in Wales have lost loved ones to it. So I think the people of Wales understand that this is a serious public health threat that we face. It's not to be fearful of it, it's to think about how we manage ourselves, how we can keep ourselves and our loved ones safe, and that's the message really that I'm trying to re-emphasize today, that there are simple ways we can do that. And if we all do that together, and I mean all of us all do that together, then we have a good prospect of keeping the viral transmission to a low enough level until a vaccine becomes available and we can eventually see the end of coronavirus as a public health threat. I hope that helps. Okay, thank you very much, everybody, and thank you for those questions, really helpful.